One of the most important things to be aware of is that colon cancer, the guidelines for colon cancer screening have changed recently for average risk individuals to begin colon cancer screening at age 45. The reason for that change was based on an increased incidence of colon cancer in younger individuals, and at times that disease process may present at a more advanced stage in younger individuals. And so for that reason, we now recommend routine screening of average risk people starting at age 45. Now, what I mean by average risk people is those that have no symptoms suggestive of colorectal cancer, and those who have no personal or family history of colon cancer, colon polyps, or other disease processes that predispose to colon cancer, like inflammatory bowel disease. Those patients who have such a family or personal history, in fact, may need to start colonoscopy examinations earlier in life, and there are specific guidelines about when those examinations should start. Colon cancer screening is very important because colon cancer is a very preventable disease depending on how early it's diagnosed. In colon cancer, we have a precursor lesion, which is a colon polyp. And colon polyps take, in general, about 8 to 10 years before they transition to a colon cancer. That gives us an opportunity through colonoscopy, for example, to identify those polyps, but even more importantly, to remove those polyps and to therefore decrease the risk of colon cancer. Some of the other tests that are available for colon cancer screening that may include tests of the stool for blood or for abnormal genetic material, and some imaging tests that evaluate the colon can also be helpful at screening for colon cancer. But one of the limitations that they have is that they can't remove the precursor lesion, they can't remove the polyps. And for that reason, colonoscopy is the preferred method of colon cancer screening, because we can not only identify colon polyps, but we can remove them. And studies have demonstrated clearly that the removal of precancerous colon polyps will decrease the likelihood of future development of colon cancer.